slides for the mental illness unit. All right, let's sort these statements into myths or reality. Use your pause button. That is a myth. Mental illness is not rare. Any verbal therapy is better than no therapy. Pause. That is true. Psychosurgery and electroconvulsive therapy, or ECT, are part of the medical model of treatment. Pause. That is true. ADHD is diagnosed, usually by a pediatrician, using feedback from parents and teachers. That is true. The insanity plea is often successful. Pause. That is true. Sorry, did I say true? The insanity plea is not usually successful. Sorry about that. All right, most bulimics are female, Caucasian, and between the ages of 13 and 18. Most bulimics are older than 18, but they usually are female and Caucasian. Anorexia worsens in college due to increased stress. No, actually, it's thought to worsen in college due to the lack of parental support and presence. Disorders of social functioning and character are called personality disorders. Pause. That is true. Okay, moving on. Let's play positive or negative symptom. So I want you to take all the symptoms at the top, pause, get a piece of paper and a pen, write down whether all those symptoms are positive symptoms or negative symptoms. And when you're ready, advance the slide. Pause. All right, so on the left, we see positive symptoms. Catatonic behaviors are actually considered the presence of something that should not be there, like waxy flexibility, so forth. I think I put it in as a negative symptom on the slides, but catatonic behavior is considered a positive symptom of schizophrenia, along with all the others listed. All right, disorders of mood. I want you to remember that there are 3 areas that are affected by depression: emotional, cognitive, and physical. I want you to get your paper and your pen and write down as many in each category as you can recall, and then advance when you're ready. Pause. There you go. You can check your list against the slide. And then symptoms of hypomania, how many of those do you remember? I left the acronym there, DIGFAST. Pause when you're ready. All right, so these are the symptoms of mania. Causes of depression. There are thought to be biological causes, environmental causes, and cognitive causes. On your piece of paper, write down all you can remember about the biological, environmental, and cognitive causes. Pause. Under biological, we have this. Environmental, talked about these, and cognitive, we talked the most. Remember that cognitive distortion could be a cause or an effect of depression, and then make sure you know arbitrary inference as well as helplessness theory in terms of cognitive causes of depression. Remember that a panic attack feels like a heart attack. And then OCD, there's a cycle. The obsessions and compulsions relate to one another. And so I want you to fill out this chart in your notes. Pause. So the obsessions lead to anxiety. I'm obsessed with cleanliness. I feel anxious about it all the time. I can't stop thinking about it. In response to that, I routinely wash my hands. Washing my hands gives me a sense of relief. However, it doesn't last very long. I become obsessed again with cleanliness. All right, there are 2 kinds of compulsions with OCD. One is controlling and one is yielding. So what do these different compulsions involve? Pause. There you go. The controlling compulsions are purposeful. The yielding compulsions feel irrational to the person. All right, phobias. Are you more likely to be phobic of honey or arsenic? It would be arsenic. And why? It's because we're somewhat prepared to feel afraid of things that could actually hurt us. All right, let's sort some dissociative disorders. So on the left, we have depersonalization, which is not as serious. Dissociation is very serious. So where does multiple personality fit? Pause. That is a dissociative disorder. How about feeling detached, not really there? Pause. That is depersonalization. How about memory loss? So that uniquely is a part of dissociation. And then I feel like I'm kind of watching events, like I'm one step back from my circle of friends. That is depersonalization. So I thought I would just include these slides if you want to review. That's helpful. Depersonalization, derealization is also helpful. Pause until you've reviewed to your satisfaction. All right, let's match some personality disorders. Okay, which personality disorder is being described here? Pause. Histrionic. How about here? Antisocial. And here, pause, borderline. And lastly, pause, narcissistic. All right, almost done. What's an example of comorbidity? Comorbidity is having more than one disorder. So for instance, you could have this, or this, or this. Questions? Make sure you understand these content areas. Thank you for watching. Good luck on the exam. Email with questions.